If you're suffering with migraines, I'd like to be able to help you. I suffered with a lot of the migraine symptoms for several years before I found chiropractic. And I'd like to be able to go over some of the causes of it with you today and hopefully give you some information that we can make a life change for you. See, migraines are an inflammatory response within the brain, and it shows up as pain in the face or in the neck, in the top of the head, visual disturbances, or even vomiting and nausea. And so it's not necessarily local pathology that's causing this. A lot of it is going to be caused from inflammation of the trigeminal nerve ganglion. Now, the trigeminal nerve is the one that innervates the face. It has three branches that goes above the eye, across the cheek, and down the chin. And the nucleus inside the brain is usually the starting point for where the migraines come from. And so nerves come off of that and they can go into the sinus cavity, and so they can mimic sinus, chronic sinus infections and sinus drippage. It can send electric wave pulses throughout the brain, and that's what gives you the aura. It can affect both sides. Migraines don't necessarily are single-sided, as a lot of people have looked at. About 60% of the time, they're going to go on both sides bilateral. About 80% of the time, there's no aura, there's no visual disturbances with it. And like we mentioned before, some of the sinus pressure right through here that you have all the time are actually migraines that are occurring from the trigeminal inflammation. They can be disabling. And a lot of people will experience light sensitivity, nausea, vomiting. But then a lot of people don't realize that cognitive changes also come from these migraines. And so one of the most common things is word finding. People have difficulty finding the proper words to express themselves. And let's talk about treatments. A lot of treatments don't work. A lot of medications don't work. So the big key we have to go with is preventing a lot of these issues from occurring. And so let's address the root cause and some of the prevention issues with it. A couple things we can do for you. I'm a certified Atlas Orthogonist, and so what we can do is help to correct the alignment of that first vertebra going in right below the head. And what happens with that vertebra, I'm going to pull a little model up here. It's a little round guy. Right through here, the brainstem and the spinal cord goes through. But when you look at the outer edges on through there, the vertebral artery runs through there. It does 4 90-degree turns before it goes up into the brain. And so when this guy is misaligned and it's rotated inappropriately in relation to the head and the lower neck, you can have some issues and inflammation. So the vertebral artery feeds the back half of the brain, and it feeds 11 out of those 12 cranial nerves. And so when that guy's twisted, it's like stepping on a garden hose. You limit the blood flow going up into the brain. And so with the Atlas Orthogonal program, we put that vertebra back into its proper orthogonal or 90-degree alignment so that the body can go back into a state of healing. So that's one of the key methods we can use for help alleviating a lot of these migraine symptoms. Now, the other thing we can also look at is supplementation and dietary modifications. And so oftentimes your body's low on magnesium or some of the B vitamins. And so we have some supplements here that have worked really, really well in the past. And we have other things we might have to look at, whether it's a dietary modification on a grander scale or exercise or reducing smoking. So I'd like to be able to help you with the migraines. Please call me at 304-933-9355. Let's set up a time we can sit down, talk, and discuss how to make that improvement for you.